We're known as the experts that go in and spend the time talking to the patient to find out, oh, they may have had a cat bite or some other exposure. Hi, I'm Dr. Somani. I'm an infectious disease doctor at NUH. So infectious disease doctors are actually more like doctors. We see a lot of patients that other doctors ask us to come and see and help manage, mainly in the hospital. So patients who may be there with complicated infections like a heart valve infection or a brain infection, or ones where they don't know what's going on. The patient just comes in with a fever and a high white count and it's not clear. So we do come in and be a consultant and help manage more complicated infections. I love ID and I've never regretted my decision. In residency and even in medical school, I was sort of attracted to wanting to be a specialist. And then the second is I've always enjoyed puzzles, especially jigsaw puzzles. So it's kind of like being a detective. And when you're an ID doctor, what you do is try to figure things out. You try to figure out, why does the patient have a fever, or why do they have a certain type of pneumonia. We're known as the experts that go in and spend the time talking to the patient to find out, oh, they may have had a cat bite or some other exposures. ID is always changing, it's always challenging, and there's always something to learn. There's been many challenges I've faced along the way. The job has also been challenging, particularly now here at NUH, having gone through COVID. So some of the challenges were working with infection control. But another challenge for ID is also we're quite active in antimicrobial resistance, and that's a challenge because we're always trying to get doctors to use antibiotics appropriately. During COVID, I had a pretty critical role in terms of the hospital epidemiology and infection control aspects, really trying to keep our patients safe from transmissions within the hospital and also keeping our staff safe. I also helped a lot with the staff vaccinations, and then eventually when we were able to give it to patients as well, setting up the vaccine clinics for COVID. I and others, of course, were awarded the Bronze Public Administration Award from the Singapore government. It's quite an honor, I was told. So I was quite happy and I felt proud to have been recognized. The award was given because of the 2 years of work. I was also involved in hospital epidemiology, which I now direct. So I think it was for those reasons that I was given the award. One of my passions has always been, as I mentioned earlier, antimicrobial stewardship, meaning trying to preserve our antibiotics, and we have a huge problem with increasing antimicrobial resistance, meaning all these bad bacteria are becoming more and more resistant to antibiotics. It's a little bit like global warming, so mainly, countries in Africa, even in Asia, where it's going to get really warm, that's also where the impact of antimicrobial resistance is going to be felt the most. So my hope for the future is that the public, as well as other doctors, recognize this and change their behavior. I'm a big proponent of education, and so I think every girl really should be able to go to school and study whatever they want to and get interested. But I also believe that it's important for everyone, including girls, to work hard. Work hard, push for what you want, never think that just because you're a girl, you can't do it.